You've been in a minor car accident. You feel shaken up, sure, but mostly okay. But then tomorrow comes, or the day after, and bam, the real pain kicks in. Today, we're going to break down what is actually happening to your neck during a whiplash injury and why it loves to play hide and seek.
Right, let's just get straight to the heart of it. This is the central mystery of whiplash, isn't it? It's confusing, it's worrying, and it's super common. One minute you're on the side of the road thinking, phew, dodged a bullet there. But your body, well, your body is about to send you a very, very different memo. So what is going on in that quiet time between the crash and the ouch?
I think we can all picture this scene. Maybe you've even been there. That sudden jolt from behind. You do a quick mental and physical check. Arms are fine, legs are fine, nothing feels broken, and you breathe this huge sigh of relief. But here's the thing. What you can't feel is this incredibly complex cascade of events that has just been kicked off deep inside your spine. The damage has already happened. Okay, so to really get this, we have to look at the biomechanics. We've got to understand what's actually happening inside your neck, because this isn't just about your head getting thrown around. In that tiny fraction of a second, your neck does something pretty wild, and unfortunately pretty damaging. So first thing we have to get straight is this popular idea of the head just whipping back and then snapping forward. I mean, yeah, that happens, but it's a huge oversimplification. The real mechanism of injury, the thing that causes the lasting pain, is happening way faster and in a much more specific way inside the structure of your spine. So check this out. In just a few milliseconds after you're hit from behind, your cervical spine, that's your neck, is forced into this completely unnatural S shape. Researchers have a fancy name for it. They call it a sigmoid deformation, but you can just think of it like a whip cracking, but it's happening inside your neck, forcing your vertebrae into a position they were never, ever meant to be in. And this right here, this is ground zero for the injury. That crazy S-curve motion forces the lower bones in your neck to slam into each other. But more specifically, they slam into these tiny, super sensitive little joints called facet joints. You can see them here. These joints are packed with nerve endings, and that violent impact is the real root cause of the injury. Okay, so if those little joints get crunched together instantly, why in the world don't you feel that sharp pain right away? This is the next big piece of the puzzle. We have to understand why this very real physical injury often hides for hours or sometimes even days. Well, it's really a 1-2 punch from your own biology. First, right after a crash, your body is just flooded with adrenaline. It's an amazing natural painkiller, and it does a great job of masking that initial damage. But second, and this is the big one, the process of inflammation starts to kick in. Swelling and irritation start to build up around those tiny injured facet joints. But that process, it takes time. It can take hours or even a day or two to really ramp up, and that's when you really start to feel it. And we need to be really clear here. This isn't just about a stiff neck for a few days. The leap from that delayed pain to chronic pain is actually shockingly common. Get this, studies show that about half, 50%, of all people who get a whiplash injury are still dealing with neck pain a full year after the accident. And here is where it all clicks together. Researchers have been able to trace that chronic, long-term pain back to its source. And they found that in over half the cases, 54% to be exact, that persistent pain is coming directly from an injury to those specific little facet joints. So we're not talking about a vague muscle sprain anymore. This is a specific, pinpointable injury. So let's just zoom in for a second on these cervical facet joints. You can see they're these small connecting joints on the back of your neck vertebrae. They're super important. They guide every little turn and tilt of your head. But the most important detail here is that they are loaded with nerve endings. They are built to feel things. And that's exactly why when they get hurt, the pain can be so intense and so hard to shake. Now, this brings us to what is probably one of the biggest points of frustration for people with whiplash. You're in a lot of pain, you go to the doctor, they take an X-ray, maybe even an MRI, and you get the call. Everything looks normal. It can make you feel like you're going crazy, but there's a really good reason why this happens. Here's the crucial thing to understand. A standard X-ray or MRI is looking for big stuff, broken bones, a slipped disc. But a facet joint injury, we're talking about microscopic tears, inflammation, damage to the soft tissue around the joint. It just doesn't show up on those scans. And this quote from the research says it all. A normal scan does not mean there's no pain. So, if you can't see the injury, how on earth do you find it? Well, doctors have a really clever and precise tool for this. It's not about taking another picture. It's about actively testing the joint to see if it's the bad guy. And that procedure is called a medial branch block. Basically, using an X-ray for guidance, a doctor injects a tiny bit of numbing medicine right onto the specific nerves that carry pain signals away from a specific facet joint. And if your pain suddenly vanishes, well, you found the culprit. It's like flipping a circuit breaker to see which wire is causing the problem. It's a diagnosis based on function, not just a picture. So once that pain generator is officially identified, you can finally get on a clear, logical path to recovery. It's not about guessing anymore. It becomes about targeted treatment for a known injury. And the treatment plan usually follows this very structured approach. You always start with the simple stuff, what doctors call conservative care. Think physical therapy, anti-inflammatory meds. If the pain sticks around, you move to step 2, those diagnostic blocks to confirm exactly which joint is the problem. And from there, doctors can use targeted treatments, like injections, to bring long-lasting relief right to the source of the injury. And for anyone thinking this is all just a theory, let's look at the hard evidence. The science is solid. The biomechanical models showing that S-curve impact, they're confirmed by studies of people who actually suffered these injuries. They find real physical lesions, actual tears and damage in the facet joints. So the bottom line is simple. A whiplash injury isn't just a sprain, it's a real physical wound. Okay, so if you remember only one thing from all of this, let it be this. It's about empowering yourself with the right words. If you have neck pain after a crash that just won't go away and you're not getting answers, you need to ask your doctor this specific question. Could my pain be coming from my cervical facet joints? It's a simple question that can completely change the direction of your care. You know, at the end of the day, all this knowledge completely reframes the conversation. It takes whiplash from being this vague, mysterious, soft tissue injury and turns it into what it really is, a specific, diagnosable, and most importantly, treatable joint condition. And that changes everything for patients, for doctors, and for how we all think about recovering after a crash.